Okay, and our last speaker before the panel is Dr. Liza Squires, who's the Chief Medical Officer at Neuren Pharmaceuticals. She's with us online today, and she's going to be talking to us about the results of their phase 2 NNZ 2591 for Angelman syndrome.
Thanks, Allison. Good afternoon, everyone. On behalf of Neuren Pharmaceuticals, I'd like to thank FAST for the opportunity to present our phase 2 data of NNZ 2591 in Angelman syndrome. Next slide, please. So NNZ 2591 is the synthetic analog of cyclic glycine proline, and this is a naturally occurring CNS peptide. NNZ 2591 is formulated to be stable, orally bioavailable, and will readily cross the blood-brain barrier. The NNZ 2591 regulates the amount of IGF-1 that's available to activate the IGF-1 receptors. And interestingly, these effects are state-dependent, meaning that it'll correct impairment, but it won't impact normal cells. And the reason that this is so important is that this signaling regulates the network, neural networks, and it really supports the development of synapses. Next slide, please. So the objective of this study was to evaluate the safety and effective treatment of oral liquid NNZ 2591 in Angelman syndrome. And this was a 13-week open-label phase 3 trial. The participants ranged from age 4 to 17 years of age, and 16 participated in the trial. This trial was conducted in Australia at 3 sites. The primary efficacy endpoints were safety, tolerability, and pharmacokinetics. The secondary endpoints include measures of treatment effects, including Angelman-specific measures, as well as other assessments generally used to evaluate other neurodevelopmental conditions. And as an exploratory endpoint, we looked at the Bayley-4, although we acknowledge that this endpoint is generally used to assess longer-term changes in development and is utilized more commonly in longer-term trials. The study was a 13-week interventional study. Prior to dosing, there was a 4-week baseline period to observe the behaviors and functioning of the children before administering study drug. This was followed by a 6-week dose optimization period where patients were titrated from 4 up to 12 milligrams per kilo BID. And then there was a 7-week dose maintenance period, and this was followed by a 2-week safety follow-up. Next slide, please. You've heard a lot about the Angelman-specific CGI measures. We also utilized them. And just for your review, obviously the CGI-I and the CIC are scored from 1, which is very much improved, through 7, which is very much worse, noting that in the caregiver impression of change, the modifier of minimally, which is used for the score of 3, minimally improved is just improved in the CIC, and the same thing is true for the score of 5, where worse is used in the CIC rather than minimally worse in the clinician assessment. During this study, clinician raters were trained and calibrated to anchor interpretations, and this occurred not only at the study initiation, but again during the study to confirm fidelity. Next slide, please. "17 patients were screened for the study. 1 subject did not meet eligibility criteria. 13 completed the study. 1 subject discontinued due to the inability to complete the safety measures. Another subject was discontinued due to a protocol deviation. They unfortunately were ill with COVID during the screening period. And one subject discontinued due to COVID. Next slide, please. So this is the demographics of our study population. The mean age was 10.1 years. 10 patients were in the 3 to 12-year age range, and 6 were between 13 and 17 years of age. 9 were female, and 7 were male. 9 of the patients had deletions, and 7 were non-deletion variants. The nonverbal developmental quotient was greater than 20 in 4 participants, and in 12, it was less than 20. And the mean clinical global impression of severity was 4.8, between moderate and markedly ill. Next slide, please. So safety and tolerability in this trial, NNZ-2591 was safe and well tolerated. Most of the adverse events that occurred during the study were mild to moderate in nature and not related to study drug. We had no serious adverse events. And as mentioned, one patient did discontinue during the study due to COVID. There were no meaningful changes in the laboratory values, ECG findings, or other safety parameters observed during treatment. On the right-hand side, you'll see the table of adverse events, and many of these adverse events are commonly seen in pediatric populations, and seizures are not uncommon in Angelman syndrome. Other adverse events included somnolence, constipation, diarrhea in 2 subjects, and then other abnormalities were drooling, insomnia, fever, and skin abrasions. Next slide, please. So moving into efficacy, the Angelman-specific CGI-I, 11 out of 13 participants showed improvement at the end of treatment with the mean CGI-I of 3, and the p-value was 0.001. 2 patients were noted to be markedly improved, much improved, and 7 were minimally improved, and 2 were unchanged. On the right-hand side of the screen, you'll see the forest plot of the specific domain scores. And on these scores, you can see that we had improvement in gross motor and I'm sorry, I missed my slide. Okay, here we go. Excuse me. Gross motor function, behavior, and communication. These 3 were significant when compared to baseline. Next slide, please. When we look at the caregiver impression of change, we see that 3 participants, 8 out of the 12, showed improvement at the end of treatment. The mean CIC was 3.2, and the p-value 0.027. 3 were much improved. 3 were much improved. 5 were minimally improved, 3 unchanged, and 1 was worse, rated as worse. And when we look at the forest plots on the right-hand side of the screen, it'd be improvements of communication, cognitive, motor communication and cognitive were all statistically significant. Next slide, please. When we looked at the age group, we saw that the children in the 3 to 12 age group showed specific improvements in that all of them improved in both the clinician and caregiver ratings at the end of treatment. And this is the caregiver is noted on the left-hand side of the screen, where 2 were much improved and the others were rated as minimally improved. And on the caregiver side, 3 were rated as much improved, and 5 were rated as improved. Next slide, please. When we look at the severity scores on the CGI, we did see a 1-point improvement, which is a fairly high bar to reach, in 4 out of the 13 participants at the end of trial. And the behavior domain, again, compared to baseline, did reach significance, but we saw trends in the remaining domains. Next slide, please. And as I mentioned, we did look at the Bailey as an exploratory measure. And over the 13-week treatment period, over 50% of the patients did show improvement in their raw scores on all the Bailey 4 subscales. And these are all shown below. And the improvement, ranged from 54% to 73%. Next slide, please. We also collected caregiver and clinician feedback through the CGIs and the CIC, and clinicians noted things such as sleeping greater than 6 hours per night, less awakenings, and requiring less intervention during awakenings, calmer, better focus, hand flapping stopped, better understanding and things they're asked to do, motor improvement, steadier on feet, better balance, less cautious, stair climbing improved, and similar types of communication improvements in the other 2 quotes. And then from the caregiver's perspective, much more settled, focused on what they're doing, calmer, better focus, balance, and concentration, improvement in gestures by pointing and showing, picking up small objects, trying to work puzzles, sitting at a table with the family without too much behavior issue, and improved sleep, balance, and again, improved hand flapping and calmer. Next slide, please. So in conclusion, NNZ-2591 was safe and well tolerated in children and adolescents with Angelman syndrome. There were significant and meaningful improvements seen by both clinicians and caregivers in global efficacy measures designed specifically to evaluate Angelman's. And these improvements that occurred are important aspects of Angelman's, including communication, behavior, cognition, and motor abilities. Next slide, please. And finally, Neuren would very much like to thank our study participants, their caregivers, the staff at our research sites, and FAST and the families that participate in supporting the development of treatments in many different ways. Thank you.
Thank you.